Welcome back to Living Local. Dental health is about more than having a pretty white smile. According to MayoClinic.org, your oral health offers clues about your overall health, and problems in your mouth can affect the rest of your body. Joining me now is Clay Schommer, and he is a dentist here in the Quad Cities, and you know that all too well. But first of all, before we get into some dental hygiene tips and advice, how long has Schommer Dental been around in the Quad Cities?
We've been in the Quad Cities since 1992, and I've been at the office for about a year and a half now.
And what sparked your interest in dental work?
I'm actually fourth generation. My great-grandfather graduated from Marquette in 1926. My grandmother was a hygienist. One of her brothers was a dentist. My dad's a dentist. That's who I work with. So it's just felt like a very natural fit for me, and I always wanted to help people, so it seemed like a good spot for me.
And it runs in your blood. I love. How is it working with your dad?
It's great. I've always had a good relationship with my dad, and he's already taught me so much in the first year and a half that I've been out, so it's been really nice.
And what do you think maybe like a family-owned dental office can provide and make special and unique experience for people?
I think it's a little cliche to say that, you know, the small town feel to it, or you get that personalized attention, but I think that our care is very patient-centered. We're thinking about the patient first. We're not thinking about what's going to be the best profit margin for us. All of our treatment plans, the options that we give, are the options for the patient to decide from. Our job is to provide the menu for them, and they get to select what they want us to do. And we give our opinion about it, and we tell them what we think they should do, and ultimately it's up to them.
And the patient is really in the driver's seat. And okay, so now we know who you are. Let's talk about dental care. So Dr. Schommer, what are some common mistakes that you see people make frequently when it comes to their oral health?
A lot of people don't put as much into their oral health as they do their overall health, and what people don't realize is how much of a link there is between your oral health and your overall health. There's a strong link in all the evidence that I have seen between your oral health, especially periodontal health, and your heart health. And a lot of people don't understand the connection to healthy mouth and healthy heart. And if you have premature tooth loss, it can affect your diet in a lot of ways. So especially elderly people, it's important to keep your teeth as long as you can, because you can't chew those carrots, those celery, those vegetables that are so important for your diet as well.
Yeah, that's so true. So yeah, and I think you make a great point that, you know, we're kind of in this trend right now of people, and it's a good trend, people caring about their outward health and getting to the gym and new workout programs and things like that. So we kind of know a basis, okay, let's get to the gym, you know, 3 to 5 times a week. For oral health, what's the workout routine for someone to have healthy dental care?
That one's really easy. It's brush your teeth 2 minutes twice a day and floss at least once a day. And a lot of people skip that last one, and it's really only a couple minutes out of your day, and it makes such a huge difference in your overall health.
Yeah, definitely, Dr. Schommer. Now, as we're entering into the new year, perhaps some families, that will be a new year resolution for them, is making dental health care a priority for their family. What tips do you have for parents out there who are trying to instill these habits in their kiddos?
The biggest thing is that make sure you see your dentist. Twice a year, it's not a lot of time, but we catch a lot of things. We find all sorts of other health issues. We're often the first people to find people at high risk for diabetes. There are other signs in your mouth that point to how your overall health is. So seeing your dentist regularly is really the most important thing. Making sure that you get to see them so that you have an opportunity to get screened for oral cancer, you get screened for tooth decay, things like that. If we can catch it earlier, then it makes it a lot easier to treat and gives you more options to treat as well.
And what if someone out there is like, my teeth feel fine, I have no pain, so I don't need to go see the dentist?
That's another common misconception that we have, is that just because it doesn't hurt, there's not a problem, when in fact, if we can catch it early, then you don't have to have things like root canal that has such a bad connotation to it, or crowns, things like that. We can catch it, do a small filling before it really turns into something major.
Yeah, sometimes when the pain comes, I mean, you're going to have to get the work done.
It's already too late.
Yeah, there's not too much preventative care that you can take on from there. So we are in the holiday season, in the thick of it, and as we all know, there's just an abundance of foods to enjoy and indulge in. What are some types of foods that are maybe worse than others when it comes to our dental health?
Sticky, sugary foods is really the biggest thing. The sticky part makes it hard for you to get it off with the toothbrush, and sugary foods is always something that the bacteria in your mouth use to break down the tooth enamel.
Yeah, I've heard that sugar feeds that bacteria. So what's the science behind that? How does that work?
So basically what happens is that the bacteria has a process where it breaks down the sugars, and that feeds the bacteria, breaks down the tooth structure, and that's how it gets into the tooth. And once it breaks through the enamel, that's when you need a filling. As it progresses deeper into tooth, that's when you're talking about more advanced treatment necessary.
So can you kind of lessen the damage by maybe brushing your teeth after you've had some dessert or something like that?
Absolutely. And drinking things like water and not necessarily as much alcohol, which during this time of year I know is tougher, but limiting those acidic drinks as well, soda, that type of thing.
So sugary, sticky, and acidic things are probably on the top of the list for things that will cause more problems than others.
Everything in moderation.
Sure, absolutely. Thank you so much, Dr. Schommer. We appreciate you being here on the show. If you would like some more information, you can visit SchommerDental.com. We'll have more details posted on ourquadcities.com. Stay with us. More Living Local is just ahead.